Can everyone hear me okay?
Yes, we can.
Yeah, I can hear.
Wonderful. Jessica, would you mind monitoring the chat because I can't see it now that I have the screen up on slideshow.
Yes.
Okay, thank you. Welcome to Office Hours, everybody. We are in May, and I wanted to welcome you all. And we're on our new platform Teams because of all the technical difficulties we had with WebEx. So I'm hopeful that this works out better for everyone. We do have a telephone option now for folks. It is live and available as of Friday afternoon. So after I did send that note out to everyone, we were able to get that live. So as we move forward, that will be an option for folks on the Teams platform. And so we're happy for that as well. As always, if folks have questions along the way, feel free to ask or stop and comment. And we have the chat function as well. We'll have a recording of this. We are recording a session. We'll have that available on our website as we move forward as well for folks. And with that, we'll get going and we'll start the presentation. Policy and procedure updates as usual.
Travis, we can't see your screen.
You can't.
There's no slides.
Okay, well, let's go back to see. All right.
Now
Well,
we can
now
see it. Yep,
you see it now.
you got it.
All right, here we are. Okay, so here we are, office hours slide deck, and we're going to get into it. So policy and procedures, quality management updates, and children's updates, and then other topics as usual. And I wanted to first welcome our newest organizations to the network. We had just completed onboarding last month with Saratoga Community Health Center through Saratoga Hospital, which is overseen through Albany Med Health System. So welcome aboard, Saratoga Community Health Center. I'm very happy to have you aboard in our network. They'll be focusing on Saratoga County on the adult side of the house. So welcome. So Saratoga Springs, they're located in Hamilton Street in Saratoga. And they also have a satellite in Mechanicville. So looking forward to working with them. So welcome aboard. Next organization that also onboarded last month that are just starting with us is, I'm sorry? And then People USA is the next organization that onboarded with us. They're going to be concentrating on Warren and Washington County with the adult side of the house. They're also out of Poughkeepsie, New York. They operate a health home care management organization down in that area as well and have for some time. So they're well known in this health home world down there. They're specialty mental health designated as an organization down there as well. So they have a lot of experience, and we're looking forward to working with them in Warren and Washington counties. So welcome aboard, People USA. So with that, we're looking forward to those two organizations to expand in our network, and we're going to go on into our policy and procedures as our next topic. We had three in this last round that Jessica's going to be touching on today. And then we have some upcoming policies as well that will be coming into the network. So Jessica, I don't know if you want to take it away for the policy and procedures.
Hello, can you hear me?
Yes.
Okay, perfect. Alrighty. So today we're going to be briefly reviewing three children's policies. Two of them are brand new. The other one is a update, but not really an update to any content. The reason I'm going to briefly review the other policies is because I do plan on having some time set aside just to review those, especially because they are applicable to such a little portion of our population. Upcoming policies we have to review are that it will be coming up is the SPOA and high fidelity wrap HCBS process, Health Home Plus for HIV, children's HCBS waiver, continuity of care, and HCBS palliative care. You can go to the next slide, Travis. Alrighty, so the first of the brand new policies that we have that went into effect on 4/1 is the children's HCBS eligibility and high fidelity wraparound determination by SPOA coordinators. So this is specifically for children's SPOA. I apologize for the title. I tried to shorten the titles, but it's hard to shorten the titles when this is what comes from DOH. And I have to make sure that we're naming the policy exactly what it is. So this policy is specifically for determinations done by SPOA coordinators for folks for high fidelity wrap and for HCBS. So when we have some kiddos sometimes that come out of various settings, there was a change to the children's waiver that allowed SPOA coordinators now to be able to do HCBS determinations or level of cares for youth that meet the SED criteria. So only for those that are in the target population for SED will this be happening for, potentially through the SPOA coordinator. So they would be doing the HCBS eligibility determination. If found eligible, they would then assist in connecting that youth to a health home or a health home, a CMA, and to get them access to HCBS. And then they can also do that high fidelity wrap screen. So the high fidelity wrap eligibility is very similar to the HCBS eligibility for SED. So they can also do that screen. So then they would also be reaching out to the lead health homes just to see who has capacity to take these referrals and to get them signed out. You can go to the next slide. So when we have kiddos that are discharged from one of these settings, so one of those settings is going to be an RTF, a hospitalization, a community residence. Anytime we're stepping down and we're reintegrating back into the community setting, those are going to be the kiddos that SPOA is going to be identifying to potentially be doing the LOC eligibility and that high fidelity wrap screen. So if they do not have Medicaid, so let's say one of these folks is coming out one of those settings, they do not have Medicaid, SPOA is going to follow the referral to CES process. So that is the process that they're doing now, and it's going to be the same process. If found eligible, most likely what the process will be is that CS referral will be routed through the health home as it ordinarily has. But then that will also allow SPOA to complete that high fidelity wrap screen before it even gets to us. So that's also a possibility. But the non-Medicaid folks will be going to CS. If the youth has Medicaid, but they're not enrolled in health home, so they're leaving a setting, they have Medicaid, but they do not have health home, SPOA can complete that LOC and that high fidelity wrap screen. If found eligible, send that information over to the lead health home. Then if the youth has Medicaid and is currently enrolled in health home, they will just directly reach out to us and then we will complete everything. I am saying SPOA may complete these things because they may not. Sometimes the process will be the same where it goes to the care manager to complete these steps, and sometimes it will be the SPOA coordinator. It's not going to be 100% of the time if the youth has Medicaid and is not enrolled in health home that the SPOA coordinator will complete the HCBS LOC and the high fidelity wrap screen. That will not always happen. It may happen. One thing that I've talked about previously is if you are receiving referrals at SPOA, it is extremely important to remember that if these kiddos have been assessed by SPOA and that are coming to you with already being found eligible for HCBS level of care and they did not loop in the health home, you want to absolutely verify that I'm aware of that this transfer is happening. They're supposed to compile a referral packet and send it to you, just as if you were receiving a referral from CS. It comes with a lot of documentation. That should be the same thing. Once everything is kind of sorted out, I do plan on reaching out to all of the children's SPOs in the counties that we cover, just to remind them that I'm the contact person for this and that we should be receiving this referral packet with accompanying these folks. Does anybody have any questions on that? All right, you can go to the next slide. So then we have another new policy, which is high fidelity wraparound for children eligibility requirements. This was a new policy that was effective in April. This policy outlines what high fidelity wrap is and the criteria for the youth to be eligible for the program. And it also covers the requirements for high fidelity wrap by the care manager. I'm not going to go into grave detail about this because there will be a whole separate assessments training that if you were on our forms training this morning, I alluded to that we're doing a children's assessment training because you will be screening, as you all know, for your high fidelity wrap kiddos through the CANS assessment process. So that's kind of embedded in there. So we're just going to touch on that there. But if you want to move to the next slide. Basically a quick overview of what it means to be eligible for high fidelity wrap. The member has to be enrolled in health home under SED or under chronic conditions and have 2 mental health diagnoses. They have to be 6 up to 21 years old. And their CANS acuity has to be determined complex. And then again, you'll have this screen at the end of your CANS assessment. Also, so there's that. Then there's also the risk factors. If we're going to use some HCBS language here, they have to have been in one of these settings or transitioned from one of these settings within the last year. That would be out of home placement. It could be a day treatment. It could be ACT. Anybody who's enrolled in HCBS, we do have a couple of kiddos that have received HCBS and high fidelity wrap, or they're utilizing crisis response services, emergency room, mobile crisis. HBCI is something that we use often around here, or foster care placement. Go to the next slide. Or they're going through the application process to receive those things. So you can be in those things, transitioning from those things, transition from those things within the last year, or be in the application for those things. May have to be involved in 2 or more systems. So there is a team to wrap around them because they are also receiving services from 2 or more systems. And then if you're familiar with our HCBS process with the 2 or more systems, then this should look very familiar. It's that same set of systems basically expanded slightly for these folks. So these would be the kiddos that we're identifying. I have started to track our high fidelity wrap outcomes in the UAS. So I've been pulling a report on that. I've also have some capacity tracking. There is no news on the expansion process right now. So really this is only available to a limited number of our kiddos right now, but the application process should be coming out soon. And then once that happens, CMAs will be able to apply to expand their services to include high fidelity wrap. Then we would have more capacity to make these referrals happen. I did run some reports between psyches and the UAS on eligibility, and we do have about a full caseload of kiddos that may be eligible for high fidelity wrap that are flagging eligible. We would just need to get the documentation and prove it. So we do kind of have a caseload that could be ready to go should someone be interested in expanding their services. Does anyone have any questions on this? All right, you can go to the next slide. Okay, so lastly, we have the transfer process between Children's Health Home and DOH or OPWDD comprehensive waiver. There has been nothing that has really changed about the policy. The steps are exactly the same. One thing that did happen is updated in April is that the entire policy was rewritten. What happened is OPWDD and DOH came together and they rewrote the policy to more clearly outline the steps. So if you're transferring from DOH Health Home to OPWDD waiver, what are the steps for that? And then if you're going from OPWDD waiver to DOH waiver, what would be the reverse steps for that? And then it outlines who is responsible for what. So the work is still exactly the same, the process is the same, but the policy is just a little bit more clear and easier to follow about who is responsible for what. Does anybody have any questions on that? Alrighty, think on the next slide.
Thank you, Jessica. Just wanted to let the network know that we have a new position that is going to be starting on Tuesday, the 27th of May. It's a quality and performance specialist role in our quality side of the house to help support the work that Taylor and Jessica have been doing on quality. We've had a lot of growth in our network in this year and some expansion that I'll be talking about a little bit further in a slide deck that's going to be coming on. And we've also got some new organizations coming into the fold, for that matter, over the last few months. So that coupled with all the auditing that we do to help support our network, there's really been a need for increased support for this type of a role. So that person's name is Kimberly Arquette. She's got a lot of experience in health home, and we're really excited for her to start in this position. And she'll be starting on Tuesday, the 27th. And she's a care manager currently in health home, and she's been doing that work for a few years now. And so she's got a lot of knowledge and understands the role and what the work is. So we look forward to her helping out in this new environment and this type of work. So she'll be able to hit the ground running. So we start to hear that name a little bit on the lead side as we move forward, and get to know who Kimberly is. She'll help to be able to support you all in the work that you do. Next thing, just wanted to point out, just a reminder that as of April, there's new DOH 5234, 5236, and 5235 forms. Make sure you're using the current version of those forms, because they clearly lay out the eligibility and appropriateness criteria. So you got to make sure if there's a change in the members' status for those areas, that the form is updated. So please make sure you're using the most current forms, and that they're uploaded into the charts as well. Any questions around
Travis.
those? Yes.
Oh, I just wanted to let everybody know, if you were on the forms training this morning or were invited, so it may be your supervisor, I did attach the deck and I did attach all of the forms that we reviewed today in the newest version. So if you didn't get them directly, then your supervisor may have, because I did send it to everybody who had registered and all of the supervisors. So those updated forms went out this morning, and I've also in that invite put the links to the new AHI website, and I also put the link to the forms page for the DOH website.
Thank you, Jessica. Is there any questions outside of what was just mentioned, or anything else around these three forms?
Yeah, no changes to the 50-55.
That's correct. That's staying the same.
Wonderful, thank you.
Taylor, you and I are going to split this screen.
Yeah. So
Right.
just to
jump into some NetSmart related things and some workflow related things for you guys. The first thing we want to bring up is comprehensive assessment errors in NetSmart. So we have noticed an uptick of folks sending in error messages that they're receiving when trying to save the comprehensive assessment. These are being triggered by folks trying to enter a provider in the professional network section, either in the medical or mental health section of the comprehensive assessment. There is an issue with it. There is an open ticket with NetSmart. That is what is causing your comprehensive assessments to not be able to save. When you do save, you'll get a little red ticker at the top. It'll say provider network in there somewhere. So if you see that, you know that it's an issue with your professional network. The workaround that we currently have for this is to just go into where you entered them into the comprehensive assessment, then save your comp assessment without those providers in there. Then once you're out of your comprehensive assessments all saved, you can go into the care coordination section and go into that professional network and enter the providers that way. But currently there is an issue that is known to NetSmart with putting them in through the comp assessment. So just note that if you're trying to do that and you come upon that error, the current workaround, but in the meantime, while they come up with a fix, is to just enter them through that care coordination section instead. And then on the safety and crisis plan, there is still an issue with printing that for signature. So the ticket has been reopened with NetSmart. They are aware and they are working on it. So for the time being, just please do your best to get an electronic signature since we're unable to print that form.
All right, thank you, Taylor. All right, so CMA's entering referrals. So as many folks know at this point, Courtney Palmer is not with AHI anymore, and we're currently recruiting for a revenue and referral specialist for the organization. We are actively in the midst of that process, and as we're assessing and going through and looking at the referral piece specifically as we're going through this process, we've had a lot of overtime in the past and currently organizations wanting to enter members into MAP and have requested overtime in the past and doing so. And the health home's always looked at that and assessed that and chosen not to have organizations do that. But as we're going through this transition period, we've taken another look at that, and given the need to ensure that members are getting into organizations enrolled in a timely fashion, and also the volume of referrals that come through the lead on a consistent basis, we are taking a step at this time to make that tweak and make it something that we're going to do across the network. So over the next couple of weeks, we're going to ask that you all start to do that, to enter into MAP, and as of 6/1, have a go live date for each organization, having identified the supervisor, identify who in your organization would be the person to enter members into MAP, and then the lead will take and pull a file and import those members into NetSmart. And our idea and our thought process is this is going to help expedite getting people, enrolled and appearing into NetSmart to get that enrollment process quicker and more expedited and expedient. So that's the step that we're going to take to get the machine a little more well-oiled, get the process going a little bit more smooth, and get things going a little bit faster for folks, because we've had a lot of requests, people wanting things to go a little more quicker, and we're trying to take steps to make that more efficient. And as we get into the next person coming into the role, this will factor into their workflow as well. So again, over the next couple of weeks, we're asking that organizations start to take these steps. The next handful of slides, we're going to walk through the steps on how to do that for the organizations who have not done this, because there are a handful of agencies that have been doing this for a while now within the network, others that have requested it. And so we're going to take some time to go over those steps in the next few slides, any questions that people have. And then again, on 6/1, we're expecting that this is going to go live across the network. So I just wanted to pause for any questions immediately, any thoughts. But it
Hi,
is something that
Travis.
yes,
It's Jessica Casey. So
Hi,
I just wanted
Jessica.
to say that we're one of the agencies that have been doing this all along. So anybody that's panicking right now or thinking that this is going to be cumbersome, we love this process and it's been really fantastic. And then the patients come into NetSmart in the status we've chosen. So if we're putting them in MAP and outreach, they come in MAP and outreach. We don't have to do, that note to transition it over. So just for anybody that's having any hesitation or worried about this process, we really like it. And we've got a natural workflow in-house that just has made it work over the years.
Thank you, Jessica, for that feedback. I appreciate that. Any other immediate thoughts, comments, questions?
We did
Before we
have
get
a
into-
note, question from Allison in the chat, Travis, that I already answered, but just in case other folks didn't see it. She was wondering if they need to notify the health home when they've entered somebody into MAP to let us know to pull it over. And the answer to that is no, it will be pulled over each morning. If you guys happen to have something that's like insanely urgent, please feel free to reach out to the health home email and we can definitely enter it into NetSmart for you. But for your typical process, you'll just put it right into MAP and we will pull that file over every morning and get everybody in there for you.
Yeah. No, I didn't read this verbatim in the paragraph on the slide, but we do have the process outlined, and it has been over the years for adults in our policy for referrals and assignments policy. So that has been part of the policy over the years. We will be incorporating the children's process into that policy. And for any of the organizations that are serving non-health home members, we will still ask that you send those folks to the lead and we'll do those entries for those folks. So, that will be the direction that we'll go for those particular members. But otherwise, part of this process has been in policy for a number of years. We just haven't made it a required practice across the network. Anything else? I just can't see the chat right now. I'm sorry. Otherwise, I'd be reading through it.
No, there's nothing else in the chat.
Okay. All right, Taylor, I'll let you walk through the steps.
Okay, so we have just a few slides for those that are unfamiliar with entering referrals in MAP. We have a few for adults and a few for kiddos just to walk you guys through this. But of course, if you need any additional support, please feel free to reach out to us and we're more than happy to support you guys through this change in workflow. So first thing you're going to do, log into MAP and you will select create referral segment. This is going to be for your adults. You will select the type of activity, which is either going to be outreach or enrollment. So like Jessica alluded to when she was saying that they've been doing this process for a while, she noted that they will go directly into an outreach or an enrollment segment, and that will carry over to NetSmart. So right now you guys are used to seeing your clients come in an assigned status, and then you have to do that client search note to put them into outreach. I just want you guys to note that that will no longer be the case because they will either go in outreach or enrolled depending on what you select here. So that time clock on your outreach segment starts the day that you put them in there. Then you'll be prompted to enter the SIN. A snapshot of that member will appear with any of their RRE codes, and then you will hit next. This is just a snapshot of what it's going to look like. When this appears, you'll just confirm the start date and hit next. You don't need to enter any other information here. It'll automatically populate to the first of the month of whatever month you're entering it in. The only time you will ever have to change it is if you are needing to backdate the segment for any reason. But for all intents and purposes, it will put in the first of the month for whatever date you are entering the referral in. So very plain and simple. As you can see, it was a pretty easy process. It's pretty quick and painless. For the kiddos, it is a little bit more cumbersome, but it's still fairly easy. So you will need to have that children's referral in front of you because for the kiddos, you do need to enter some information directly off of that referral. So when you log into MAP, instead of selecting create referral or segment, directly below that is a button that says Children's Health Home Referral Portal. So for anybody under the age of 21, even if they are going to be entering into an adult program, if they're in that 18 to 20 range, you're going to have to enter them through the Children's Health Home Referral Portal. If you have a kiddo that's in that 18 to 20 range, you will be prompted later on in the workflow to select which program you want to put them in, and then you would select either adults or children based on whichever program they have selected that they would like to be in. So once you hit that Children's Health Home Referral Portal button, you'll select yes to the services question. You'll enter the segment type, again, outreach or enrollment. And next, it'll walk you through entering information for the member. It'll ask you their foster care status, how you obtained the consent to outreach the member, their SIN number, and that the member was referred by phone. Then you can go ahead and hit next. You'll have to enter your referral rationale. So you'll be entering chronic conditions only, HCBS only, chronic conditions, and HCBS. Most members will likely fall under that chronic conditions only, and then you will hit next. You'll select your eligibility criteria and use whatever you have on the referral form. So if you select your chronic conditions, you will have to enter in at least 2 of those chronic conditions. They can be broader categories if that's all you have on the referral form. For like mental health or asthma, for example. Then you'll go ahead and hit next. Then you'll enter the referral source information. So whomever you got that referral from, you'll enter their name, their organization, their phone number, etc. And then you'll do the same for the consenter. So if it is, again, that kiddo, because they are in that 18 to 20 range, you'll just enter their information. Or if you received a kiddo that's under 18, you will enter whoever the consenter is for that individual along with their contact information. And then the following screen will pop up. Then you will confirm the information and start date. You do not need to add any information to the screen. Again, this looks very similar to what it looked like for the adult population. It'll auto-populate the first of whatever month you are entering the referral in for. This is dated to 5/1/2025. On the next page, you'll be prompted to select the CMA. You will select whatever CMA you guys are with. And then a snapshot of the member's information will appear. You just confirm that and hit next, and then you'll just get a little confirmation pop up and click submit. Any questions on entering those referrals into the system? Again, that was a very brief overview, but we are more than happy to help anybody walk through this process the first few times if you guys need assistance.
Thank you, Taylor. All right, Jessica, did you want to touch on the children's program updates?
Yes, I just want to talk about a couple things on the kiddo side. I just wanted to let everybody know for a couple billing things going on. Our current CBQ is having some issues on the back end. For whatever reason, it's flagging that they can't process our CBQs because HCBS and other conditions was selected. However, we've cross-checked the CBQs. You're not selecting that. It's still causing rejections. NetSmart is working on this. We're the only health home having this issue, even though the CBQ is standard across all New York State health homes. But they are currently working on this. Do not worry, we will get everything resubmitted. The other thing that I wanted to remind everybody of is with the new CBQ, your core services have to be on separate dates. So when you're completing your core services for the month, you want to make sure that you're completing them on different dates. Multiple core services with the same service date will count as one service. So if you have a low acuity member and you did 2 billable core services on 5/20, that would only count as one core service because they have the same date. This is a change from our previous, how we previously billed and it's not blatantly written in DOH policy. So please keep that in mind that core services need to be delivered on different dates. The other thing is when you're filling out your notes and if you're delivering a core service to a member, you want to make sure that you're hitting member as the target. So it will ask you for the target and that should be selected as member. I talked about it briefly earlier for high fidelity wrap. There will be a new application process. There's still no start date for that. At the conference, I was able to get it clarified that if you had previously gone through the high fidelity wrap application process, and you were previously a provider, but you stopped being a high fidelity wrap provider, then you will have to go through the new application process. So anyone who's currently doing high fidelity wrap, you're okay. Anyone who has historically done it, stopped, and would like to go back, you will have to go through the new process. Allison is asking, why did the target change even if we aren't talking directly to the member? So it did and it didn't. If you're providing a core service and it's not to the member, you can select exactly who you're providing that core service to. In our core services policy, it lays out how many core services the member has to have and then how many have to be given to the member. So it's across, if you look at that crosswalk appendix that I have, it'll show you that a low acuity member has to have 2 core services per month, but they don't have to always be with the member. It only has to be member quarterly. So if you are filling out your CBQ in your notes, whoever you're doing the contact with, you can put the correct contact type, but you have to do your core services or your member contacts with the member. In those notes, the target has to be the member. And if there's any confusion there, Allison, I can resend over that core services billing deck and I can let you know exactly what crosswalk I'm referring to. Any other questions on that? Alrighty. Next is the comprehensive CANS combination assessment. I still have not given this a good name other than CANS combination. I just wanted to remind everybody that this is now one assessment as of March 4th. So you no longer need to do the comprehensive assessment that is in NetSmart. You only need to do the CANS, which incorporates both assessments into one assessment. However, we want to make sure that we are adding the appropriate supporting information in our CANS. So as you walk through CANS, you can see the addition of those questions that are on there. Then we're really supporting the actionable items in those CANS. So this is just a snapshot that I took from one of our CANS that we had. And it shows for any item rated actionable, so those are your 2s and your 3s, please provide a summary of the circumstances of the child and family, as well as sources of information used to determine those ratings. So as you all know, we cannot do our CANS without supporting documentation. You have to have materials or conversations, your interdisciplinary team meetings referenced to kind of support those ratings. So if you're telling me that a youth is complex, why are they complex? What is supporting that complex acuity? And then you would write something in the box. So it's super important that the details that you put into that little box, that free text box, really support your ratings in that section. I did put a screenshot here. I did put a screenshot here of an example of what is in there and what we're kind of looking for. So if your ratings do not look like this, I would kind of take this as an example. As I talked about earlier today, and I've mentioned today that we're going to be doing that children's assessment training. This is one of the things that we'll be talking about and going into a little bit more detail. But you just want to keep in mind when you're doing your CANS comp combination, you want to make sure that you're supporting your acuity with information that you've gathered from providers, information from your IDT meeting, and then you're going to want to put in there what is supporting those actionable items. If you rated something a 2, why is it a 2? If you're rating something a 3, why would it be a 3? All of that should be in there. We did have a couple questions come in, and it said, I had a problem putting in a CBQ yesterday for one of my intensive use. It wouldn't let me complete billing because my contact was not listed as member. Then I fixed a note saying member instead and accepted. I thought it was strange. Yes, it is strange. One thing that I'm thinking about doing, Allison, is I am thinking about putting in that crosswalk and amending, okay, this is your acuity, this is how many contacts, this is how many member contacts, and your IDT crosswalk, adding in there another column that calls out exactly what we're looking for to get your billable service to go through. So it's just a little bit more clear. Someone says Data Den still isn't showing our comps as overdue since we're doing them separately. So Taylor answered this. So yes, we do. We still have that comprehensive assessment report in Data Den. Those will continue to show overdue until we kind of do away with that. What we're doing is they're being filtered out on quality notebooks, and that CANS date now generates on there, so we know when your CANS was done. So in the meantime, if you have an overdue comp and you're waiting to do the CANS, you can let that comprehensive assessment be overdue because we're waiting for those assessments to line up. So this is the only time you can kind of let your comps go by the wayside and be overdue, because we're going to catch up to when your next CANS date is. Does anybody have any questions on that? Alrighty.
Thanks, Jessica. I just want to take a little moment just to let folks know that we're approached by the Department of Health and we're offered expansion into Montgomery and Fulton counties for both adults and children, and it was effective May 1st. So now we are operating 10 counties under our AHI Health Home for adults and children. So I just want to let the network know that we have that umbrella for 10 counties now for adults and children. So we're excited about that and look forward to working in those 2 counties as we move forward. And I also wanted to put a big thank you out there. Champlain Valley Physicians Health Center Hospital, they actually sunset their care management organization as of last Friday. They're no longer a CMA in our network. They closed their CMA for health home services due to some other initiatives that they're working on through the hospital. They've been a great partner for a number of years with us in network through Clinton County and the North Country region. So I just want to take a moment to note that and thank them for everything that they've done. And, you know, they're going to be a great partner moving forward as well through some other work that we'll do just by virtue of the work we do in the North Country. So just wanted to make sure that you all were aware that they are no longer part of our network for health home care management. And just acknowledge the good work that they did and do. So just wanted to put that out there. A lot of years they were with us. They've been with us pretty much the duration that we've been a lead, actually, a long time. I think Jessica referenced earlier on today, and then also possibly this morning in her forms training, she had said as well. But we have a new Health Home webpage. We have a new HI website that got just pushed out recently, a whole new setup and rollout. Our Health Home webpage within that website's all new as well. We are tweaking some final updates on it just because with any new rollout, there's some little tweaks here and there. So we're going in and just doing some little updates. So if you're in there and seeing anything that just doesn't jive in with what you think your organization should have or see, let us know, and we'll make those tweaks because we are going in and going through things again as well. What I will be sending out to the supervisors very shortly is the partners page and asking each of the supervisors through your organization to take a look at your specialty areas and update and accordingly make sure that you're comfortable with what each of your specialty areas for your agency contains because I think it's been a while since that's been updated. So I want to make sure it's referencing what you feel it should so that we can get that current and then on the webpage looking good. So I'll get that sent out in the near future here. But get in there, check it out. We like the format. I think overall it's a nice refresh, and we got new layout looking and some new information. It's just freshened up. Looks good. And then we got an upcoming training, graduation and disenrollment. Jessica's going to be putting on the 29th of May, 11 o'clock. And Jess, I don't know if you wanted to touch on the micro training series that you got cooking.
Yeah, so if you were on the training this morning for forms, I talked about it then, but we are going to be doing a micro training series. I just literally couldn't come up with a better word. So basically what we're trying to do is 30 to 45-minute trainings that really just target a specific area of Health Home or specific policy or a specific item that the care manager or supervisor is responsible for. So the intention of those is kind of to be short and to the point, 30 to 45 minutes. This morning we did forms. We're going to have adult assessments, children's assessments. That one absolutely is not going to be 30 to 45 minutes. I apologize in advance. Billing for adults, billing for kids, just various topics. So if you have any interest in sending in a topic, absolutely reach out. I think we have about 8 that we're going to do and that are under development. So if you have any ideas or things you want covered, please send in your thoughts.
Thank you, Jess. And that's what we have for today. Was there anything that anybody wanted to talk about, discuss that we did not mention or talk through today? Well, if not, as always, thank you for everything you do each and every day and appreciate your time today. Hope you all have a great afternoon.
Thank
Thank
you,
you.
everybody.
Thank you.
Have a great day.
Thank you.